Hey, Dr. Lindsay here. This is another in a series of talks that I'm giving on topics that come up at our office. Today's discussion is on trichophytic scars. Trichophytic techniques were developed by facial plastic surgeons as an alternative technique for brow lifting in the early to mid-90s. Typical brow lifts would make an incision from ear to ear, elevate up the forehead, and pull the hairline back 3/4 of an inch to an inch. And that left many women looking abnormal with these unusually tall foreheads. So the way around that was to make the incision just at the hairline. But unless the doctor were really lucky, that scar would show and again call attention to the fact that the patient had cosmetic surgery. So some clever facial plastic surgeons developed a way of making an incision about 1/4 to 1/2 inch behind the hairline and angling the cut so that the hair roots were preserved when the skin was lifted up. I'm going to show you this in a relatively crudely drawn picture. So this technique, the doctor makes an incision and angles it so that the hair roots of these first 3 hairs are preserved and the hair shafts are lifted up with the skin. The forehead's elevated, this skin is trimmed off, and then when it's sewn back, hairless skin is sewn over top of hair roots, and the scar is placed several hairs behind the hairline. And then when these hairs grow in 3 or 4 months, it hides the scar line. And I've probably done 80 brow lifts using this technique, and it really does work well. So in the mid-90s, a relatively clever group of hair transplant doctors decided they would try that in the back to see whether they could improve hair transplant strip scars, and indeed it does work. So we do that on virtually every patient, where we angle the incision on the upper edge and the lower edge of the strip. Once the strip's removed, we place dissolvable deep sutures to take the tension off of the skin edges, and then the skin edges lie together. We sew those with some stitches that come out at a week. And in theory, and in practice in most people, the hair does grow through and across the scar line, giving better scars. But I think a bigger issue, at least at my office, is strip width and limiting skin tension. Scars are directly proportional to how much tension is placed on the skin. For example, in facelifts, I've done maybe 3,600 facelifts. If you just take out skin and don't suspend anything else, the skin will rapidly stretch back out and you'll be left with a disfiguring scar in front of your ear. So in a typical facelift, the tension is placed on the muscle. The muscle is lifted and a small amount of skin is taken off. Some stitches are placed beneath the skin to hold the skin edges together, and then the skin itself is sewn together with some sutures that stay in for 5 or 6 days. With hair transplants, we did the same thing. At our office, we limit the width of the strip to about 1.7 centimeters. Sometimes with somebody who has very lax skin, we can get 2, maybe 2.25 centimeters. And on redo, sometimes we're lucky to get 1 centimeter. Somebody that's got a lot of scarring from lots of previous plugs. But on average, we plan on a 1.7 centimeters strip the width. And the only thing that varies is the length. So for a small 1800 graft case, I'll remove a strip up at the length of this, 1.7 centimeters, centered on the back of the head. But for a big case, we'll go from just in front of each ear all the way around the back of the head. But again, the width only stays 1.7 centimeters. And we always do at least a 2-layer closure. And on redos, many times we'll do a 3-layer closure, with bigger sutures placed deep underneath the skin that eventually dissolve, but stay long enough so that hopefully the skin heals together without leaving a wide scar. The skin sutures are taken out at 7 days. And we usually ask patients to use vitamin E on the scars after that point. This is how we do it at our office. There's plenty of very reputable doctors that take a much wider scar and do much bigger cases. At our office, we can typically get up to about 4,000 grafts with a strip that length and that width. And I'm not saying that our way is the right way, but it's the way we do it at this office, and we tend to get really pretty decent scars. On average, and I've posted this many times on the forums, we do 122 cases a year. I probably get 4 scars a year that just aren't very good. And I just don't know who those are going to be on. Our typical poor scar is probably the width of this thing right here. And then we probably get 110 or so scars that are about the width of this. and then we probably get 8 scars that are just almost impossible to find. But again, I just don't know who those scars are going to be in. So you have to plan for the worst and hope for the best. But I think even if you plan for the worst and limit your strip width, things will turn out reasonably well as far as the scar goes with the normal hair length. Hope this answers your questions. Make sure that you bring this up for discussion with the doctor that you're choosing, and good luck to you. Thank you.